That's right, not everything is flowers in this apparently promising world about the use of cannabidiol. If we are going to prescribe, we need to be aware of possible side effects more than THC in fact than CBD, but it will not always be possible to separate the wheat from the chaff, so sometimes we will need to discontinue the treatment, and I also think that the patient needs to have the exact notion of what side effects he may experience during his treatment. CBD in general is well tolerated, even in large doses. We also need to take into account that many patients are polymedicated and still use some medication even after the introduction of cannabinoid therapy, which can be a bias in the interpretation of side effects if they exist. I will quote here, in a simplified way, the main side effects of each of the two main cannabinoids. CBD, increased liver enzymes, dizziness, fatigue, gastrointestinal changes, both diarrhea and constipation, changes in appetite, excess and lack of hunger, weight changes, weight gain or loss, and some drowsiness. THC, increased heart rate, decreased reaction time, cognitive impairment, impaired coordination, impaired vision, psychotic effects, dry mouth, anxiety, fatigue, dizziness, and euphoria, all due to the compound's psychoactive properties. None of the compounds is fatal, however, they may be intolerable to the point that we have to discontinue their use, especially since the gradual increase in doses is part of the therapy, and even if the prescribed compound has more CBD than THC, as if you increase the dose as a whole, proportionally there will also be an increase in THC. Strict monitoring is essential. Dr. Ana Luisa Rosas, neurologist, graduated 20 years ago from the Federal University of São Paulo. Scientific Director of the Brazilian Alzheimer's Association. You heard Gericast, a Brazilian podcast about longevity and health. Production and creation: Williams Fiore.